Climate change is one of the most pressing challenges of our time, with profound and far-reaching effects on global health. Today, let's focus on a critical intersection of climate change and health and the rise and spread of infectious diseases, and more specifically, how Europe navigate these challenges through adaptive strategies and measures designed to mitigate the consequences of climate change. Europe, though the second smallest continent, spans 10.2 million square kilometers and is home to over 740 million people, making it densely populated and diverse in climate, culture, and ecosystems. The geographic and climatic variety makes Europe particularly vulnerable to climate change. Climate change in Europe will affect infectious disease burdens by influencing pathogen and vector survival, reproduction, and spread. Rising temperatures may increase foodborne microorganisms, while longer summers heighten food handling risk. Extreme weather and heavy rainfall could also overwhelm water systems, leading to waterborne outbreaks. In the study of Semens et al., the graph shows trends in foodborne and waterborne diseases in Europe from 1995 to 2007. Campylobacteriosis increased steadily and overtook salmonellosis, which declined significantly. Cryptosporidosis fluctuated over time, suggesting seasonal or outbreak-driven variation, while listeriosis, though rare, showed gradual increase, highlighting its growing public health concern. With this, the European Centre for Disease Prevention and Control has devised a process of climate change adaptation to infectious diseases that involves the following. First, a systematic approach was used to retrieve peer-reviewed literature on climate change and food and waterborne diseases. It is organized in an online database by thematic and spatial aspect. This model allows researchers to identify patterns and relationship between climatic variables and disease outbreaks.
The ECDC has developed an application called the ECDC Climate Change Modules for Quantitative Microbial Risk Assessment, or the CCMQ-MRA, which allows users to simulate infection risks under different climate scenarios, enabling risk quantification, effective resource allocation, and the development of practical adaptation strategies. In forecasting the data, the European Environment and Epidemiology, or the E3 network, a data repository constructed by the ECDC, provides access to environmental and infectious disease data to member states, academia, legislators, and other authorized users, with the purpose of increased surveillance and strategic public health action. As climate change is one of many public health issues, policies should align actions to reduce climate-related risks with existing programs. The ECDC has developed a handbook to help European member states assess and manage changes in infectious disease risks by identifying weaknesses in public health infrastructure and evaluating climate-related hazards. Vulnerability assessment also requires considering vulnerable populations like the elderly, children, pregnant women, those living in remote areas, and individuals with disabilities due to their increased risks, as well as social vulnerability, which involves collaboration between sectors like water management, the food industry, veterinary medicine, nature conservation, housing, and planning. All these steps eventually lead to effective adaptation strategies that address both present and future health risks from climate change. Such strategies include regulations and surveillance systems for foodborne, waterborne, and vector-borne diseases, along with public awareness campaigns, vaccination programs, and early warning systems.
Since 2011, DOST Pag-asa has produced climate projection tools in the Philippines such as CliMap, an interactive map for visualizing provincial rainfall and temperature projections, and matrices like CIRAM and CLIRAM for assessing climate risk and adaptation options. These tools are vital for evidence-based decision-making to mitigate climate impacts and enhance resilience. With significant progress in delivering climate information for action planning, the focus should now shift to improving funding efficiency and utilization by LGUs to strengthen climate mitigation strategies inspired by Europe's adaptive and preventive frameworks. Climate change impact on public health, especially through infectious diseases, demands a comprehensive multi-sector approach. Europe is building resilience through evidence-based research, proactive risk assessments, and strategic forecasting, with effective adaptation strategies such as strengthened surveillance, regulations, and public awareness. While the challenges are great, they also offer an opportunity to unite, innovate, and adapt. By acting today, we can protect future health and create a more sustainable, resilient world for generations to come.